Good morning, everyone. I'm glad you could make it. Well, today's presentation is being recorded for the purpose of televising on public access. The Swansea COA offers various activities and services presented by volunteers or nominally paid practitioners. Participants do so with the understanding that the Town of Swansea, its COA, and employees do not assume legal or other responsibility for the advice or services rendered. The Swansea COA is pleased to welcome and introduce today's presenter, Maria Pimentel, with the Massachusetts Senior Medicare Patrol.
Thank you. Good morning.
Good morning.
Good morning.
Good morning.
Hi, everyone.
Hi.
I'm Maria Pimentel, and I'm a volunteer for the Massachusetts Senior Medicare Patrol since 2011, okay? First of all, thanks to all of you for coming. Thank you so much. Thanks to Julie and Mrs. Pimentel for giving me the chance to bring to all of you the SMP message. I appreciate it. There's one more thing I want to mention before I go on. This is on my first presentation was on this senior center in 2012. So this is a very special place to me, okay? And I recognize some faces. They were here in 2012. I mean, you bring some pastries, some goodies over there. Feel free to help yourself on the coffee table. That's the way, my way to thank to all of you, okay? Okay, if you have any questions during this presentation, feel free and ask, okay? Unless you want to wait until the end. If there's any Portuguese-speaking persons in here that needs translation, I can do too. I can help, no problem, okay? So the SMP program is a federal funding program since 1997. In Massachusetts since 1999, 2 years later, okay? There are 54 SMP programs across the country. You understand me? Yeah. Can you understand me good? Yeah. Okay, great, that's it. There are 54 SMP across the country and U.S. territories, including Washington, D.C., Guam, Puerto Rico, and West Virgin Islands. Okay, so this program, it's everywhere. The SMP program operates under the leadership of Elder Service of Merrimack Valley in Lawrence. So the office, the main office, it's in Lawrence. Okay, and they have, volunteers everywhere. I'm one of them. So this program doesn't work alone. It works in partnership with other organizations to better serve elders, okay? So they work together to serve, okay. Like Shine. Shine, it's one of them. Everyone knows who Shine is, probably, so. So the goal or the main purpose of these programs it's to educate all Medicare and Medicaid beneficiaries, family members, caregivers, how to be engaged on their health care, okay? So it's very important. So how to becoming proactive and engaged healthcare consumers, okay? And for what? For different reasons, to protect, detect, and report healthcare fraud and abuse. That's the main mission of the program. So we bring this information to all of you so you have an idea what you need to do. I know most of you know, but it's always good to remember. Fraud and abuse can cost us billions of dollars annually, okay? It's waste of money, billions of dollars annually. And the most important thing, it can cost your life or the life of a loved one. Okay. Okay, another thing, on those envelopes, for your information, on those envelopes that I give it to you, they're on your table. You find an S&P brochure, okay, and a personal health care journal that helps you to maintain information about your visits to the doctors, clinics, tests, exams, medications, and much more. So you have about 6 pages, blank pages that you can write down all that information, okay? So I'm not just telling you to do it because I do the same thing. That's my healthcare journal. So this is the way you do it, okay? That's the name of the physicians, that's the medications, everything. So whenever I have a visit to the doctor, tests, I take this with me, everything gets in here. It's much, they love this because they have, I mean, it saves time, saves a lot of time. These journals are also available in Portuguese, Spanish, Vietnamese, Russian, Korean, and Chinese. With me, I also have Portuguese and Spanish. If anyone it's interesting, just come to me at the end, I'll give it to you. They are on the table. Okay. Okay, let's talk about the 3 most important steps in preventing healthcare fraud. There's quite a bit of steps, but these are the 3 most important steps, which is, it's on your brochure. Protect, detect, report. This is the 3 most important steps. Protect, it tells you to protect your Medicare, Medicaid, and Social Security numbers like a credit card number, the same thing, okay? If possible, don't carry them until you need it for visits to the doctors, tests, clinics, whatever, okay? And never give it to a stranger, okay? And record doctor's visits, write down doctor's visits, and exams, medication on your personal health care journal. So this is where we do. This is what I do, and I still have plenty of space for the moment. Okay. SIF, MSNs, which I'm going to show you, SIF, MSNs, and the OBs, which is the Part D of explanation of benefits. I'm going to show you. This is your Medicare summary notice. Everyone knows, probably have when they need them, from Medicare, okay? And this is the OBs, which is explanation of benefits, okay? Since we are talking about OBs, I'm going to give you a quick explanation what a EOB is. I don't have this. Okay, so I'll probably get them a little bit later. I'll give you the, okay. So what the EOB is, whenever you get your Medicare summary notice, you also have, about the same time or probably a few days later, AOB explanations, part the explanation of benefits. Okay, so what's AOB? AOB is a monthly statement that lists any medical service you have received on the previous month. Okay? Usually AOBs comes from your Medicare supplement. Okay? I'm sure Most of you has Medicare or Medicare supplement. And the EOBs are sent, this one it's from Tufts, but it can be another company. So EOB, it's not a bill, okay? It's a report that helps you keep track of your service, okay? It's only, EOBs, it's only sent to members who use their Medicare benefits in the previous month. If you didn't use, if you did not receive any medical care, you won't receive a EOB, okay? So that's pretty much what this is. It's explanation of benefits. This one, it's from Humana, but there's a few different companies. Yeah, okay. Let's see. So it says protect, detect. What about, I talked about protect, what about detect? Detect means review every time you have your statements, MSNs, Medicare summary notice, or EOBs, please review them carefully and compare with your healthcare journal. Because if you find any mistake, there's something wrong. You gotta agree, you gotta be correct and agree with your MSNs and with your healthcare journal, okay? And with receipts from medications too, from prescriptions, you should do it. When you're on your MSNs, on your statements, you should look for three things that are very important. That's where fraud happens a lot, in these three things. Charges for items or service not received, okay? It happened to me once. They charged me someplace, charged me for service that I never received. Okay, so what I did, I called them first. We called them first if they, for them to repay the, yeah. If not, call your plan, because if not, call S&P. They will help you. Okay. Billing for the same thing twice. That happens a lot too. Okay, that's fraud. And service not recommended by the doctor. Okay, if not recommended, if you see something that was not recommended by the doctor, it's wrong. Okay, these three things are the main three things that happens where we find more fraud or abuse. It can be abuse too, not fraud. This is different. Report, if you suspect that you or someone else that you know have been a target of fraud, please report it. Just trust your intuition. Usually works, okay? And if something does not seem right, check it out. Just don't say, check that out, okay? Because doing this, you protect your benefits. It's not only you protecting your benefits, and you protecting other people's to be victims of the same problems, okay? And at the same time, you're helping your Medicare benefits, okay? So what do? If you find a problem, you call your health plan, or you call healthcare provider or plan with questions about information on a summary notice and the EOBs. So whatever you have to ask, call them first and try to solve the problem before it goes. Okay, if you're not comfortable with their response, this can happen. If you're not comfortable with their response, please call S&P. They will help you. It's on the first page. It says I don't know if I'm going to mention it. It's 1-800-892-0890. Okay? So if you have any, if you're not happy with your response, just call them, okay? Let's see, Medicare parts, I'm sure most of you, or all of you know that Medicare is made of 4 parts, A, B, C, and D, and each one covers different service. Part A covers the inpatient admission, inpatient nursing facility, USNF, home health care, VNA, hospice care. Okay, so since we are on a Part A, okay, I have, if anyone needs any copy, just come to me at the end. I'll give you a copy of this. This is a very important thing that it's covered by Part A. It's hospital admission status, inpatient versus observation. I'm going to read this. I want the viewers at home to read because this is one of the most important things that we have. Okay. When it comes to hospital admission, be sure to ask if you are admitted as an inpatient or an observation. Okay. Hospital admission status can make a huge difference in whether Medicare will cover rehab at a skilled nursing facility. This is good only if any of you needs to go to the nursing home after the hospital. If you go home, straight home, you don't need this, okay? And because an observation status admission could have caused implications related to service like X-rays, lab tests, and drugs. What they mean with this, they mean if you are on observation, if you go to a nursing home, you're going to end up to pay all the expenses at the nursing home. Medicare won't pay anything. Okay, so you have to find out how you are admitted at hospital. You ask, I'm on inpatient or observation. If you feel too sick to help, just take a person with you that can help you. Because the hospital, they're supposed to tell you, but if you don't ask, they won't tell. Okay, so it says, for most patients, the difference in between one and another, it's meaningless. Some people think it's nothing, but it's not. Okay. The patient will get the same care, but under Medicare rules, when it comes to paying for rehab service, the program, which is Medicare, picks up the whole tab for the first 20 days of rehab if the patient is admitted to a hospital as an inpatient for 3 days. 3 days consecutive. Okay. What they often call the 72-hour rule. Okay, 3 days or the 72-hour rule. If the hospital admission was observation, okay, for all part of the stay, the patient could be responsible for the entire cost of the rehab. I met a lady in New Bedford. She's on this position. She went for a hospital for about a week, and she never asked. Nobody helped her. And now she went to the rehab center for 2 weeks. Now she has to pay for the whole thing because she was admitted as an observation, not an inpatient. This can be a big.
I have a question for you. You were saying about the 72-hour observation.
Or 3 days. Yeah.
3 days. I said to the nurse when I was in the hospital, I stated that, and she says, if you're in the hospital, it means you're admitted.
That means you admit it.
That's what she told me.
That means, yeah, you admit it. But what's the status of the admission, inpatient or observation? That's where I'm trying. Observation. So that's the problem. If you are on observation for 3 days, if you need to go to the rehab center, if you need to go to the rehab center, Medicare won't pay anything. You respond. Yeah? Okay, but sometimes you need to go to the rehab center. Okay? So this lady that I met, she's on this problem. Exactly what she's paying for the rehab. She's trying to get help. They said no, because so she spoke with the director, the SMP director, Lucilia, and she's trying to help her. I don't know if she's going to do anything because she was on observation all all that time, which is wrong, okay? So if you go home, this doesn't apply if you go home, only applies if you go
How can you
to,
afford to pay now?
huh?
How can you afford to pay?
She made a payment plan. So the payment plan, the hospital says you pay whatever you can, based on the income that you get. So they didn't tell her you have to pay this amount. But it's wrong, okay? Because the hospital have to tell people you are on observation or inpatient on observation, and they don't tell if you don't ask. Usually the person that's very sick doesn't have, not going to ask any questions, but she'll have another person with them to ask.
That's not what I meant. What I meant, I asked the nurse.
You ask the nurse.
She looked at me if I was totally out of it. She says, where'd you get this information? And I said, from the daycare and from the papers that I had.
But what she said, she told you that you were on a hospital. How long you were over there on a hospital?
I was for observation for 3 days.
Yeah. So you stayed there for 72 hours.
Yeah, but what she said to me, that what I was asking her, it wasn't true. And I told her it was because previously you had been here.
Yeah.
And I had the information home. And I told her that I was...
She probably doesn't know what she said.
Yeah, would it affect? A patient doesn't know, a nurse doesn't know. Who's going to know?
This is real. This is, I'm reading this. This is from Medicare, so we got to be careful with this. This happens a lot, okay?
I think you better be careful when you write your name.
I mean, it doesn't have anything to do with the name, this. This is the status that you are admitted to the hospital.
Is that paper in here?
No, but I have a few over there, and I can ask her to make some copies, because you should remember this, okay? Okay,
Someone else is going to. Wouldn't it make more sense for the hospital to...
excuse me?
Wouldn't it make more sense for the hospital to instruct the staff to have people admitted as patients? Because that way they're going to get their money, right?
That's right. It is, but they're not always do the right thing, I'm telling you. Yeah, they think everyone should know this. That's why on all presentations we let people know this is a very serious matter, okay? So if you ask, they will tell you. If you don't ask, or have someone else with you that can ask questions. On the healthcare field, the healthcare is so complicated, you have to ask questions. Otherwise, you don't know what's going on. You have to ask. Okay. So so it says in here, we recommend that patients inquire about the admission status. Important if the patient is going into rehab to a skilled nursing facility. If you go home, it doesn't matter. Also, if any of you has that plan, the Medicare Advantage, it works differently. If you have Medicare Advantage, it might cover, because Medicare Advantage, I'm going to talk about that. Medicare Advantage covers the Part A, B, and the Medicare Supplement, all three at the same time. So you might pay a premium, but it's the best plan you can have. Medicare Advantage, which you can, I have, but I'm going to explain more about that. Okay, so I did the Part A. The Part B provides health care benefits, which helps cover the following service: doctor service, Part B, doctor service, equipment, home health care, x-rays, lab service, outpatient service, and mental health service. It's all Part B. Part C, or Medicare Advantage, that's the one, works in place of Medicare A, B, and Medigap or Medicare Supplement. Okay, so if you have Medicare Advantage, it covers all these three. Okay. Medicare Advantage also covers, most of the times, extras that Medicare doesn't cover, okay, like such as vision, dental, and transportation service. Medicare Advantage covers much more than, okay. Part D, everyone knows, covers prescriptions, medications, okay? The open enrollment for Medicare Advantage, I mean, when you have a Shine Council, they tell you because they work with the open enrollment. It's Part C and D are from October 15 to December 7. You can only do changes once, okay? But you should not change anything without see a Shine counselor, because they will help you to decide what's the best for you. Okay, don't change anything by yourself. I'm telling you, it's more complicated than you think. Okay, like I told you, SMP doesn't work alone, works with collaboration with organizations to serve elders. Okay, like Shine, it's one of them. AARP, which stands for American Association of Retired People. SHIP, State Health Information Assistance, okay? And some more. There's plenty of programs at work. So there's a flyer. That's the one. There's a flyer that you have on your envelopes. This is a very important. Gaining access to research for Massachusetts seniors. This flyer, one side gives you information about all the programs available in Massachusetts for all the seniors. If you need them, these are all of the phone numbers, so it's on your envelopes. This is a very important thing, all the programs that you should need. Okay. Okay, on this area, probably no bad for probably because SMP works with the Bristol Elder Service, Coastline Elderly Service, South Coast Legal Service, and a few more. So they all work together. Okay, let me ask you a question. Did you remember how much money is lost annually on healthcare fraud and abuse? You have any idea?
Billions.
Huh?
Billions.
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 The government estimates between 60 and 90 billions. That's a lot. Waste of money. Okay. Okay, let's talk about fraud. Fraud happens when someone intentionally, because fraud, it's always intentional, okay? Lies in order to get paid, to get reimbursed for service not provided. That's plain. So fraud, it's always intention and can be committed by any person or business that are in position to build the Medicare program. For example, doctors and healthcare practitioners, okay? Equipment suppliers, employees of companies that manage the Medicare billing, and beneficiaries. Beneficiaries do that. Okay, so which, it's all of us. Okay? Exempts of fraud, billing for service supplies not provided. Okay? Billing twice for the same service or item. Unnecessary lab tests, which happens a lot with tests. I think we take so many tests that are not necessary, and Medicare, it's responsible for the payment. And offering or receiving kickbacks, okay? Receiving kickbacks and some more things. I mean, this is only a few. Abuse, usually it's overcharges for service or supplies. It's not like fraud. It can be an error. An abuse can be an error too. Everybody can make mistakes, okay? Improper billing practice that exceeds the limiting charges because there's a limit, okay? Claims for service not necessary, and so on, so on. So what do you think it's the difference between fraud and abuse? I remember that I asked that question in 2012, and there's a lady that give me a good answer to that. So I explained what fraud is, you know what fraud is, and what abuse is. What's the difference between one and another? Huh? It's not the same thing. I mean, there's a difference.
What is intentional? Yeah.
That's right. It's intention. It's Pretty much intention. Yep. Yeah, because an abuse, an error can be a mistake. That's right. Okay, great. And the most important thing, pay attention, this practice brings consequences for the beneficiaries, such as theft of Medicare and Medicaid numbers leads to false claims. Okay, first one. Second one, benefits may be affected. File may be flagged, do not pay. Imagine that. I mean, you're waiting for your check and then you don't get it. Huh? And may result in higher payments and higher Medicare premiums. Okay? That's what the consequences of theft, of fraud. I mean, I wish it never happens, but another thing that's very important, if you can, if you remember, always stick your S&P Healthcare Journal. Oh, Jesus. To every appointment you have. The thing is, you have, don't leave them without anything, just mark down and record all your visits, times, days, time, doctor's name and everything, and take them with you to all the, with you on, take them with you wherever you go, take them on weekends, on vacations, because you never know, you might need them. Okay, okay. I went to Portugal last year, I took mine with me, and I needed it over there for one medication that I want to refill over there. And I was, I mean, usually you don't remember the name of medication, so complicated the name, so I give it to them and they say, okay, we know what it is. So this is one example. So write down all your questions and responses from the doctors. Not only questions, responses from doctors, nurses, and providers. Be sure to understand what they say. If you don't understand, ask again. I mean, I don't think they don't like that, but they have to. There's limitations on a Part B. Check limitations on Part B because in some cases you might need prior approval for some of your medications. I have a lady in New Bedford there. She's on a nursing home and she had this problem. The company, the pharmacy told her, you have to pay this amount of money if you want to have your medication. And she was not expecting that. A co-payment of $300. Okay, so I'm going to meet with her this week and see really what's going on. It's tough. I mean, always make sure the medication belongs to you. And if you remember, count your pills. Sometimes it's not one. Okay, I'm going to be quick. I just want to give you a quick idea what's our work as a volunteers, okay? I'm going to talk about me and about all the other volunteers, okay? Because the message, the SMP message, it's the same one across the country. Okay, we are trained by the program to provide the Medicare and Medicaid beneficiaries with information, okay, and guidance to prevent, detect, and report healthcare errors, fraud, and abuse. And how we do it through sessions like this one, workshops, we do workshops, or sometimes reaching the beneficiary one by one, which we all do once a while when it's necessary, okay? Some people, they can't come to senior centers, they are at home, or so.
They are very good to go home.
Huh?
They are very good to go home and check.
Yeah.
They are, because they did.
Yeah. Oh yeah, we do that. We also conduct outreach and education through interviews on TV, newspapers, and mostly on summertime we do a lot of health fairs across the state, okay? And throughout the state with SMP table information. So what we do, we give away information to the people. We give away the SMP message to the people, okay? Based on our training, we can also help seniors to better understand their Medicare summary notice and explanation of benefits. We have to be trained on that more profoundly. Okay, so before I finish, I have a few more notes. It's going to be quick. Let me ask you, do you remember the 3 most important steps in preventing healthcare fraud and abuse? I mentioned that. Protect, detect, report. If you remember those 3 steps, you probably won't have any problems, but you have to focus and okay? So, because we are all responsible, it's not only my neighbor or you, we are all responsible on preventing healthcare fraud and abuse, and how the best thing, becoming fully engaged healthcare consumers, okay? Pay attention to everything that's going on in your life. Pay attention, the main thing, pay attention to your statements from Medicare, to explanation of benefits from the Medicare supplement, whatever Medicare supplement, whatever company you have, okay? And some of you don't have a Medicare supplement, might have Mass Health. That helps. It depends on income. So if your Mass Health doesn't send anything, but you can see on a statement from Medicare what the other party paid, or what and what you should pay. Most of the times, if you are on the Mass Health, you don't pay anything. But on the Medicare supplement, it happens. So there you go. This is what calls engaged on the healthcare field. We have to be, because it's very complicated. So only together we can protect all of us, and for future generations, for our sons, our...
If you have Mass Health, then you can't have Medicare, right?
Of course you can. Everyone has Medicare since...
My husband's in a nursing home. We just got Mass Health for him.
Yeah.
All right. Now, last week we got a letter from Medicare saying that they're not gonna, whatever they take out of our checks a month,
Yeah.
they're not gonna do it anymore because he's covered 100% on the Mass Health.
Because the nursing home's taking it.
Excuse me?
The nursing home's gonna take it. That's why he's not gonna get any more.
Oh, yeah, yeah, yeah.
They're gonna,
Oh, yeah.
the nursing home's taking that.
Yeah, I mean, Medicare always pays. I mean, that's 80%. They don't pay 100%, 80%, and the other 20 or Mass Health or a Medicare supplement. So that's true what she says. Yeah. The nursing home takes everything.
I know that. They take your whole body.
Let me tell you, if you can stay home, it's the best thing you do for all of us. I mean, there's a lot of programs that can help you at home.
They provide a nurse,
Yeah.
provide a homemaker.
They provide a homemaker. They provide everything. So please, do whatever you want, but this is the best thing. Nursing homes, they take your money.
In fact, they had told us that if we didn't get the Mass Health, then we weren't entitled to, like nursing care or like that. We would have to pay for that out of our pocket.
It's probably because your income your income and your husband was less than the guidelines, so you can, because to have Mass Health, you only can have a certain amount of income. So that's it. But Medicare always cover everyone after 65. It's because, like she said, it's true. The nursing home takes the money. Because what Mass Health pays, it's not enough. So someone else has to pay their money.
Said the Medicare said the Mass Health was paying 100%.
100%?
They take out of our checks a month, whether it's $100 or what. They said they weren't going to do that anymore.
So they were not going to take the money from you anymore?
Out of the Medicare. They weren't going to take that.
No, but I mean, out of Medicare, no. The money comes from Social Security.
Well, so
Yeah, not Medicare, which is a different thing. So they're not going to take any more money from your benefits? That's what you were trying to say?
From the,
So MS Health covers 100%?
that's what they say.
Oh, that's,
That's what they told us, Mass Health is covering 100%, because before we got it, we was paying.
wait a minute, and you still receiving your benefits and your husband still receives his benefits from Social Security?
Yeah, but we was paying $500 a month just for his room and board.
You paying 500,
We were paying it out of our.
so from probably Social Security sends to them?
So now the Social Security, yeah, we got the letter from the Social Security that whatever they take out a month, whether it's $100, that they weren't gonna take it out anymore, you know?
So MS Health going to cover everything. There's some exceptions, believe me, on MS Health. So you got to be better off with that.
Well, I'll tell you, what we went through for Mass Health,
Yeah,
I wouldn't advise anybody.
I'm not surprised with
I
that.
wouldn't advise anybody.
Yeah,
I mean, it was taking time out of work.
it's very confused.
And they lost the files, they couldn't find this, and they couldn't.
Believe me, MS Health, of course, of the healthcare field in the United States, it's so complicated. I'm telling you.
It is a mess.
It's a mess, especially MS Health, it's a mess.
I wouldn't
They
advise
have so many people under them that it's messy. Yeah. So, good. Okay, thank you for sharing that with us. Okay, there's another thing that happens. I don't know if already, if someone calls you and says that they're calling from Medicare, hang up the phone. Okay? Medicare does not call beneficiaries to offer them any goods or service, never, okay? If anyone calls you about insurance offers, tell them to send you a letter in writing, never on the phone, because that happens. Okay, and that's about it. Thanks to everyone. I appreciate your attention, okay? Thank you. If you have any more questions, just feel free, ask. Okay?